Starting. Okay, good morning.
Good morning.
We're going to wait just a few more beats. We've just started the webinar. It's 10 o'clock. We have people loading on. Thank you for joining us.
Yes.
For our panelists and staff, if you could hover over your video and rename yourself to your name. Right now, it is just a general EACAD panelist name. So please rename yourself so we know who's joined us today. We look like we have folks on the line getting going. Well, good. I think we'll go ahead and get started while people are getting going and getting themselves settled. I want to welcome you to the first meeting of the Equity Advisory Committee on Aging and Disability. We also call it EACAD. Good morning, my name is Carol DeAndres, and I am the Stakeholder and Public Engagement Manager on the Master Plan for Aging team here at the California Department of Aging. So I'm going to do a few little welcome remarks and logistics, and we can get going. And Destiny, I am going to spotlight you. Thank you. We have, this is a virtual webinar. One more back, please. We have ASL, American Sign Language, is provided. You also have closed captioning through the Zoom webinar functions. We will be posting the slides and the transcript and the recording on the California Health and Human Services Master Plan for Aging webpage after this webinar. And I have said this before, committee members and staff, if you could please update your name display on Zoom by right-clicking in the upper right corner of your video and selecting rename. Right now, we just have a general EACAD panelist. So we'd love to know who has joined us today on the panelist side. Next slide, please. I'm going to spotlight myself. There I am. Hello. I do want to highlight some virtual meeting operations. The chat function is enabled for committee members and department staff to share meeting-related resources and information. The public's able to view the content shared in the chat during the meeting. The chat and the question and answer functions are not enabled for comments and questions from public attendees, but we do invite the public to provide comments during the public comment period, which is on the agenda at the end of this meeting. And of course, if you'd like to submit written comments, we're happy to take them at the engage, ENGAGE, at aging.ca.gov. Next slide. So for the public comment period, attendees joining by phone, you can press *9 on your dial pad. And the moderator will announce the last 4 digits of your phone number and will unmute your line. And for those attending by Zoom, you can click your raised hand function, and then we will unmute your line. So we do want to note that the public comments commenters have 2 minutes. And of course, again, written comments can be made to our engage at aging.ca.gov. This is, again, the Equity Advisory Committee on Aging and Disability. Today is our first meeting, January 11th, 2024. And the committee purpose is the purpose of the Equity Advisory Committee on Aging and Disability is to advise the administration on the implementation of the Master Plan for Aging, as well as the California Department of Aging on the planning and implementation of aging and disability programs, services, data collection, and staff development. And of course, we couldn't do this without our committee members. So we do want to take this time to acknowledge our committee members. Thank you so much for being a part of this committee. We have a few more to add. They are all here on these two slides, and we thank you so much. You can find additional information on our committee members on our Cal HHS website, where we have short bios of our committee members. Again, we have a few more to add, so we will be updating that, but that's where you can find our information on our committee members. And we do thank our committee for sharing their time, their expertise, their lived experience with us. Without you, we wouldn't be able to advance equity here at the Master Plan for Aging. So your time is very much appreciated. Next slide. Okay, I'm going to hand it over to Marina, who will take us through the rest of our meeting. Marina, do you have your video on?
Yes, I do.
Here we go. I'll find you.
Okay.
Here we go. Thank you.
All
Go
right.
ahead, Marina.
Thank you so much, Carol. I want to appreciate you and Jackie for all the support in planning for this meeting, and also my team. Also, I just want to welcome all of you to the first Equity Advisory Committee on Aging and Disability. I'm very excited to be starting and welcoming the new year with you all. I look forward to our continued work together, and having the discussion today about prioritizing our work and aligning our efforts with CDA and the MPA is, to me, going to be a robust discussion, and just really eager to get the work started. And so with that, I'd like to just turn it over to CDA's Tribal Affairs Manager, Consuelo Gambino, to do a land acknowledgement for us, to start us off in a good way, and so that we always show respect and we recognize the indigenous peoples of this land in their good traditional stewardship. And with that, I'd like to just turn it over to Consuelo to do that now. Thank you.
Thank you, Marina. And I just want to echo what Marina and Carol said, and thank you everyone on the committee and everyone who is here today for your valuable expertise and your contributions. We appreciate all of you and want to wish everyone a prosperous new year. And so today, as we attend the Equity Advisory Committee on Aging and Disability meeting, we take a moment to acknowledge the tribal lands in California on which we are gathered. For many centuries, the lands in California have been home to numerous tribes who have protected and respected the sacred lands in which we all reside. The tribes in California are sovereign nations, rich in culture and traditions passed down from tribal elders. I am attending this meeting from Roseville, California, and acknowledge the indigenous homelands of the Nisenan Maidu people and honor their resilience and cultural preservation. And with that, I would like to go ahead and hand it back over to you, Marina.
Thank you. So next slide, please. So I'd like to walk us through our agenda today. As you can see, we have a full agenda, including many presentations and updates. And also, we've left room for some discussion. We really want to hear from you. We want to make this an interactive meeting. And so I welcome your input throughout the discussions that we have today. Having said that, knowing that our time is pretty limited with as much as we want to cover, but we'll do our best. And again, we welcome the input. First and foremost, I want to just report that we have another new staff member. So you'll be hearing from Yia Zhang today. I'm very excited to bring her on board. We will also have an MPA and CDA update, along with some time on the agenda to talk about EACAD priorities, discussion areas, and how we focus our time this year. We will have an MPA equity framework update, And also I want to acknowledge Ross and team for launching the LGBTQIA plus study that launched on January 8th. So we'll be hearing an update from Ross and how we as a committee can support that effort. And then we will also have a discussion on tribal engagement. And we're really hoping to, again, hear from you all how you can support our effort in reaching our tribal communities, both our urban and in the rural settings as well. We have left space for public comment. And then I will wrap up with some closing remarks and next steps and summarize what I heard today during this meeting. I want to just, before we move on to Gia, I just want to give a few minutes of time to welcome and again, very excited to bring on 3 new committee members. Unfortunately, one cannot be here today, David Miguel Villarino, but Michelle Fonseca and Ephraim, I know I'm going to mispronounce this, but Gaitahun are joining today. So I want to just turn to Michelle first, just to talk a little bit about your background and what you hope to bring to this committee, and then we'll turn it to over to Ephraim. And nice to see you, Ephraim. Didn't get a chance to welcome you this morning.
Good morning, buenos dias. My name is Michelle Fonseca, and I'm thrilled and I'm really excited to be sharing this space with all of you. I'm from the Mission District in San Francisco, and I'm extremely proud of my Nicaragüense roots. I have a background in sociology and psychology, as well as I have a master's in social work, and I'm currently pursuing to become a clinical social worker, a licensed clinical social worker. And what I really hope to bring to this committee is to amplify my voice, to advocate for the Latino community, as well as to apply my knowledge from the areas of my own personal experience, social work, and mental health. But most importantly is to be intentional about my learning and about collaborating with the other members of this committee, as well as from the California Department of Aging. Thank you so much. And Happy New Year to everyone.
Thank you, Michelle. Welcome. Ephraim?
Thank you. Thank you, Marina. Nice to meet you, Michelle. And you pronounced my last name right. Yeah, it's Ephraim Gaitahun. Perfectly said.
Okay.
So my name is Ephraim, they, he pronouns. I'm the Director of Strategic Partnerships and Training at Open House, which is a senior center here in the heart of San Francisco. And I come with a clinical background as a nurse, predominantly working in memory care. And then that very quickly turned into coming here at Open House. And I've been here for a little bit over 4 years and some change. And my entire job is essentially going into the existing infrastructure, begging clinicians and social workers and the organizations and or systems that they represent to see the humanity in our aging queer elders. And really, it's simultaneously for myself as well, because I am terrified of aging in this Western society as it exists. So I'm excited to play whatever small role in being able to uplift the needs of our aging queer elders.
Thank you both and welcome again. We appreciate the compassion and passion that you bring to this work. So. Sorry, I don't know. Was I on mute? Sorry about that. Just welcome again, and we look forward to our work with you. Thank you for your compassion and your passion for working in this space. So, okay. So Yia, you're on deck, and I'm very excited to have Yia on board. I've worked with Yia at the former Department of, at the Department of Public Health, and we are joined once again. So Yia, the floor is yours.
All right, thank you, Marina. And hello to all. Again, my name is Ye Zong. I use she, her pronouns, and I'm glad to be here with you all today. A little bit about me. I grew up in a single parent household most of my life with 7 other siblings. My dad passed away when I was 7 years old, and then my mother passed away in 2011 from an aneurysm, which I later learned was due to the stressors in her life. a mental illness that she was unable to confide in us children. So at the time, I was attending UC Merced, majoring in anthropology and minoring in public health. With my mother's passing, it sparked my curiosity and passion to pursue a master's in public health at Touro University. Growing up, my mother would always say, get a good education to support myself in the future. And I've always kept this close to my heart as I'm a life learner. Family is also a big part of who I am. Just because growing up in the Hmong community without a father, you hear things like the kids will kind of like fail at life. But I don't want that to be the thing in our family. So that's why I'm currently pursuing a doctoral degree in public health. And I submitted my capstone project for review, and we'll know the results by the end of this quarter. And then I started my professional career after graduate school at the Hmong Cultural Center of Butte County. I was the health program lead, overseeing all the health programs at the center, which included the Zhongxie program. The Zhongxie means happy in Hmong. It is a mental health program for the Hmong elders in reducing their stress, anxiety, depression, and isolation. It also increases their socialization skills and their physical and mental well-being. One thing that I loved about working with the elders was just seeing their smiles, when we would have group activities or when we took them on field trips or, just going to their homes for in-home site visits. And then I really miss working with them on the ground, especially with the community, but I know that working here at CDA, I'll make a bigger difference. Next slide, please. And then my role here at CDA consists of supporting the implementation of the Racial Equity Action Plan, as also known as the REAP. In addition to the REAP, update the Racial Equity Tool for CDA. I also support my colleague Consuelo with the tribal engagement listening sessions, as well as other community engagement at CDA. Another project that I'm working on is the Language Access Plan with CDA staff. Since starting here at CDA, I've been supporting Marina and Consuelo on providing equity technical assistance to the CDA divisions and other entities. What that looks like is providing feedback on documents and incorporating equity throughout the document, and also making sure that everyone is at the table and descriptions are equitable. What I envision my role going forward is all the above, plus attending site visits, especially visiting programs that focus on older adults, family caregivers, and disabled persons to learn more about the programs. I want to expand my knowledge and apply equity where it is needed. Next slide, please. And then thank you for allowing me to give a brief introduction. I look forward to working with you all in the future. Again, thank you, and I'll turn it back to you, Marina.
Now, do you understand why I'm so happy Yia is on the equity team here at CDA? So again, welcome, Yia. I know we'll be a powerhouse together, Consuelo, you and I look forward to what's to come. So next slide, please. So with that, I'd like to turn it over to our director, Susan DeMorris, to provide an update on the MPA and CDA. So take it away, Susan.
Thank you. Thank you very much, Marina. Good morning, everyone, and a happy new year. Welcome to 2024. I want to start first by acknowledging a huge milestone. Just over a year ago, the Department of Aging, which is celebrating its 50th year this year, had 0 staff resources solely dedicated to equity, 0. And today we are so proud to have Marina leading the department's equity team, as you just saw and heard from Consuelo and Yia, both such outstanding hires. And to me, it's really important to commemorate this, that we now have this powerhouse team of 3 as we look at a state budget shortfall. We are fortunate to have these resources from prior budget years fueling our work. So I'm just delighted that this committee gets to better know CDA's equity team through our work together. On a related note, we have a new Master Plan for Aging project manager, Jackie Tompkins, who you may know, our new members may not know, was promoted in December to take on this role, and we're thrilled to start the 4th year of the Master Plan for Aging with Jackie at the helm. Congratulations on your promotion, Jackie. And one of her first orders of business is to produce our Master Plan for Aging annual report to the legislature, which has been finalized and is in final design and copy work. And we'll be releasing that at the end of this month. So we're eager to share that with all of you. In my time today, I wanted to highlight just 3 items for all of you, each centered in equity. There's lots we could update you on, but I wanted to focus just on 3 items. First, the governor's release yesterday of the proposed 2024-2025 state budget. Second, CDA's continued work on the Older Adult Behavioral Health Initiative. And third, the start of work to reimagine and strengthen California's Area Agency on Aging network. So first, the budget. Despite a budget shortfall estimated at $37.9 billion, the governor put forward a proposed budget that continues to prioritize a California for all. There are new revenue solutions, delays and deferrals, and minimal cuts. In fact, the California Health and Human Services Agency general fund budget stands at the same level as last year, $73.9 billion in general fund resources for a combined total of $253 billion in proposed health and human services spending. I want to acknowledge Secretary Galley's leadership and the governor's commitment to health for all. Briefly, I wanted to just mention to you, if you're not closely tracking the budget, all Medi-Cal coverage expansions continue, including full scope eligibility for all ages, regardless of immigration status, effective January 1st, 2024, this month. Nearly $15 billion in behavioral health funding. Continued investment in CalAIM, including up to 6 months of rent or temporary housing. Expansion of home and community-based waiver, HCBA waiver and assisted living waiver slots, reinforcing the Social Security SSI, SSP COLAs and the SSP increase. And there has been no proposed impacts on IHSS rates or backup provider funding. So I think this is something that, I really want to make sure that our community knows that the core programs that serve the most vulnerable members of our state are intact, largely intact. Second, related to the budget, the Department of Aging retained our funding, $50 million for the 3-pronged Older Adult Behavioral Health Initiative. You may have been tracking this work. In fact, that's where we first met Michelle, I believe, at one of our listening sessions in San Francisco. This includes an ethnic media campaign, continuation of Friendship Line, the statewide warm line for emotional support. And the most exciting part is $30 million for community capacity building grants. This initiative grew out of extensive stakeholder engagement and a series of community listening sessions around the state. We are currently developing the frame for the community capacity building grants with the target of reaching historically underserved populations and developing culturally competent programs. I will share on screen how to contact us through our inbox. If you'd like to volunteer as an advisor to this work yourself, or if you want to lift up any people, programs, or organizations you think we should seek guidance from, please reach out to our OABH inbox. And then last, I wanted to close with my third update. We just concluded a year of intensive stakeholder engagement on a project called California 2030, CA 2030. This was an in-depth review and analysis of our state's network of 33 area agencies on aging. We call them AAAs. And the work was, all of the work was through an equity lens. If you happened to join the Cal HHS stakeholder call yesterday, you heard from Secretary Galley that this is one of our policy priorities this year as an agency. We expect to issue our final report next week and hold a public webinar at the end of this month. And I invite all of you to follow along and weigh in, as this is consequential. This work is consequential to the future of home and community living for people with the greatest economic and social need in our state. So we'll share a link there about our California 2030 work so you can follow along with that. And that concludes my remarks. And I'm so happy to turn it back to Marina.
Thank you, Susan, for that presentation. I just wanted to see if any of the committee members had any questions at this time before moving on to the next portion of our meeting.
I'm not seeing any hands, Marina.
Okay, I was just going to say, I can't see them on my screen, but okay. All right. Well, I think this is a very exciting portion of the meeting. And the reason I say that is because this is where we get to hear from you all. I want to just mention, as Carol was going through her logistical slides, that she talked about the purpose of the EACAD. And so I just wanted to mention that one more time, that really your role is to advise the administration and CDA on the MPA, on aging and disability programs, services, data collection, and staff development. I'm also cognizant that given the budget deficit and given a number of initiatives that are already in motion, that many of the responsibilities related to equity can seem overwhelming because there's so much to do in this space. But I want to switch that frame a little bit, and I want to change that paradigm and just frame it in the way of opportunity. When I look at all your bios, when I've done meet and greets, and I have spoken with some of you, I see the power in the collective of being able to harness our partnerships, leverage opportunities to help us lift this work and sustain this work. But in doing so, I think it's very important to set our priorities and to be mindful and thoughtful and intentional of the work that we plan to do this year. So with that, in this next slide, I just wanted to highlight a few of the what I call natural priorities that are already in motion, and how this committee is instrumental in supporting those, but also open the floor up to what other ideas and thoughts that we have that we feel really have urgency, that really need some attention. And so the CDA priorities, as I mentioned, is tribal engagement. We've identified that there is a lot of room for growth for us to really dive deeper and meet with our tribal partners and gain an understanding of some of those barriers and then the strengths and resiliency that we can hone in on. The other is the LGBTQ plus study for older adults. As I mentioned, this launched January 8th, and we're hoping that we can spread the good word. And then what do we do with the findings and operationalizing what we learn? That's going to be another key component of this committee. And then lastly, the MPA equity work that you'll hear more about during this our time together. As most of you know, I did some meet and greets with some of the committee members. I don't think I completed meeting with everybody, but I hope to continue those going into 2024. 2 items of focus were older farm workers and justice-involved older adults. This is not to say that we are limited to that. I just wanted to highlight those to let you know that I heard you, and I wanted to represent them here in the slide deck. But this discussion really is about hearing more and hearing from you about recommendations where maybe we need to learn more, dive deeper in. And all this is going to help me frame our future meetings, because what I would like to do is, depending on the prioritization and recommendations received by the committee, is that the next 2 meetings would be focused on selecting 2 or 3 of those priorities and diving deeper, meaning that we would have focused presentations on those topics, and then in between time, build subcommittee work that can help and continue building the momentum. Next slide, please. So as we open the space for open discussion and recommendations, and I want to acknowledge that this is the first meeting. We have about 15 members now, where we would like to add 5 more. We have 3 who have joined. And so this discussion may probably need to happen offline as well, but we can generate some general ideas and kind of float those. But in thinking about your recommendations, I would like you to keep in mind these 4 areas. One is assessing the importance and urgency. Also, just as I mentioned, the alignment with CDA and MPA priorities, given the limited bandwidth of the Office of Equity, and also the budget deficit that we just heard about. And then how do we measure value and impact? What do we want those outcomes to look at come year's end? You know, what do we hope to achieve? What do we want our big wins to be? And then lastly is resources required. You know, what is it going to take to lift these recommendations off the ground? Where can you dive in as a committee to help lead some of those efforts? And then how we as a department can do be a partner in that as well. Next slide, please. So this is my last slide before I just open the floor. And one is, I wanted to identify a few ways that you can help support the Office of Equity as we embark in several fronts as well in lifting equity efforts within the department and also externally. So as I mentioned, participating on subcommittees on equity priority areas is going to be instrumental in our work. As I mentioned, keeping the momentum, keeping the motion going, and keeping the conversation going. Given that I've looked at all your biographies and the work that you've done, many of you for years in the space of aging and disability and in other kind of fields, you know, serving as trainers, reviewers, and subject matter experts to CDA staff as we implement priorities is going to be critical and very important. And then lastly, we do want to grow our membership even more so in the areas that we have gap areas. So we want to identify some of our gap areas within the committee, whether that be having more representatives from those from the disability field or other areas that you've seen. We would like to recruit more members to this committee so that we have a balanced framing and how we move forward. So with that, I would like to turn to you all. And if you want to just comment on the 2 focus areas that were identified, or if you have any input regarding the priorities already in motion with the department, I'm going to stop talking and I'm going to be all ears. So I think I can see you all, and I'm looking at my participation screen for hands raised, and I see Jax.
Thank you, Marina. Thank you, Susan. Thank you, everybody on the panel for your participation in this. I've been really grateful to be participating in the LGBTQIA study over the past several months and look forward to hearing the report on that. But one of the things I wanted to bring up, and this is something, since this is my second go round with the committee, that when we were when I first came on board, one of my priorities was trying to work with the 4As, the AAAs, to really do something in terms of implementing the Senate Bill 258 that was passed in 2021 on the HIV and Aging Act that identified people who were aging with HIV as a population of greatest social need. And when Susan was mentioning the California, the CA 2030 restructuring of the AAAs, I really wonder whether or not that's still part of the priorities. I know a couple of years ago that at the top of the chain in the AAAs, trying to actually get data and to actually answer the spirit of the act, the HIV and Aging Act, was really a priority. But I don't know what's happened since. So I just want to raise that issue and to make sure that we're still thinking about that going forward. Thank you. Marina, I think you were on mute.
Thank you for raising that, Jax. I have that noted, and I'll follow up with folks in the department on this. Thank you. All right. Alvira, I see your hand.
Yes, good morning. And again, thank you for all your work, staff of CDA moving forward in 2024. And I just want to again acknowledge and thank you for your leadership in bringing forth Mr. David Villarino with expertise and knowledge on farm workers. And I think that we definitely have a good team again on this particular topic, and look forward to doing more work on that in this coming year. Thank you all.
Thank you, Alvira. All right, Vincent, I see your hand.
Hello, everyone. I'm having a lot of internet problems this morning, so I'm going to stay off camera. But echoing what Jack said, we're actually going to be convening an HIV and aging conference in the SF Bay area. It's either going to be Redwood City or San Jose on June 5th of this year. It commemorates with Long-Term Survivor Day. And it would be great if this committee could have a presence there. We did one in December, which was led by UCSF, and that was more of a regional conference. But this is specifically about California, and I will share information as it becomes available. We are planning it with organizers from Northern and Southern California, but I'd like to put that on our calendar as something that hopefully we can see members from this committee attend.
Thank you, Vincent, for the invitation, and that would be awesome to attend if we're able to. All right, I thought I saw Julia's hand raised. Did I get that right?
I didn't have my hand up, but I'm happy to chime in. So just to echo everybody else, Happy New Year. It's great to see everybody again. And Susan, I love seeing all of your posts on social, keeping people up to date on what's happening. Marina, thank you for the leadership. Biggest thing that I see and interact with folks that I engage with online and in person, as my background as a journalist and then a caregiver, and now doing my work with Keeping It Real Caregiving, which is not part of any other agency, is that when I speak with other members of the community, they still don't have any concept of all the different work that's taking place. I did a presentation to the Society of Professional Journalists in September. And I pulled together two other members who are involved in aging issues, a gerontologist and an area agency on aging family planner out of Colorado. And we had about 25 journalists in our session, which is huge for this topic to get that many journalists who attended. Most of them, and they were from all over the country, were thrilled to learn about California's MPA. That was part of my presentation, as well as the gerontologist. He included that. And I encouraged them to then reach out to their own leaders in their communities to say, hey, what is our state doing? What is our region doing? And they had very little information about any of this. And so we gave them links. We pointed them in the right direction. I love my state, so I'm always a cheerleader of saying, here's what we're doing. So as we move forward, that connection of really engaging journalists. And it may be finding one person who is either going through it themselves, so now they've opened their eyes to why this is important, and filling that gap so that people understand that it's not about waiting until you're in it to learn about it, that here is why it's important for all of us to pay attention to all of these issues. So I'm working on a couple of things moving forward into this year as well. But I think if to connect more with journalists on a very applicable level. Not always the numbers and the stats, which we know we need for funding and programming and moving forward, but in simple everyday terms that your average layperson goes, oh, they're talking about me, and this is how it's going to impact me, and here's what I can do. So I think that that's important for us to keep that in mind across all of the focus areas.
Thank you, Julia, so much for raising that, because I know in just our limited work right now with tribal communities, they have a lot of questions around just like, how do we get paid to care for a caregiver? You know, how do we get paid to care for our elder, you know, parent? How this? So some basic questions that are coming up regarding where do we go to even, you know, get services? And so I think that that is a very key point, the messaging, how we message to different communities, and connecting with, you know, ethnic media, and the importance of how we connect. So thank you for raising that. Really appreciate it. All right. You know, I'm gonna turn to you, Michelle, and also Ephraim, being new to the committee, coming in maybe with some fresh eyes. What are your thoughts? What do you envision, you know, in terms of, you know, if you've participated in committees before, or this is a new committee for you? What are your thoughts?
Well, this is my first time being part of a committee, but like I said, what I said earlier, I I hope to come in to learn and to collaborate with the other members of this committee. And I really liked what Julia said about the regular person, the layperson, having access to this information, and what you said, Marina, about ethnic media. So as of right now, I'm actually working for Ethnic Media Services here in San Francisco. And so this organization really has a lot of network with ethnic media. So with, you know, the indigenous communities, with Latino, with, you know, Asian communities. So I think that that connection with ethnic media, it's really important. I know that you guys do have that connection with ethnic media service. So I think it's really important to really keep that going. And as well as I think language accessibility is something that is really important, right? Because not everyone is everyone is, you know, English speaking. You know, the diversity, the cultural competency, you know, that's a very important aspect that I think we need to continue to focus on.
Thank you. Thank you for raising the language access piece. That's something that the department is working on right now in the development of a language access plan. So thank you for raising that for those limited English speaking individuals that have a very challenging time, oftentimes understanding their prognosis or understanding their treatment plan, their medication regimen. So thank you for raising that. Ephraim? And then I see, I think Rigo has his hand.
Yeah. The LGBTQI+ study obviously greatly attracts me. I am always nervous about how we inadvertently make swaths of the population invisible, inadvertently, right? I think it's great to cast this net very wide, but how deep is it? And you know, how are we going to think about reaching specifically a lot of our aging trans population? And if I'm curious, and this may very well be the case, but the language access, and oftentimes the translations that are offered in surveys that I've experienced as other surveys, usually through local universities, the translations are oftentimes derogatory terms by accident, which have kind of created a barrier for a lot of our Tagalog speaking, Mandarin or Cantonese speaking population of Asian queer adults. So I think if there's a way that I can participate in that, I would love to be able to dive a little bit deeper in supporting that, and maybe building the connection, facilitating some of the partnerships that it will take to really get the quality data that we want and need.
Great. Thank you. Thank you, Ephraim. Thank you for volunteering to support that facilitation. Much appreciated. Rico, did you have your hand up?
I did. I just wanted to echo, I think, some of the comments about, really appreciate the leadership of CDA and the evolution of this committee and how far this is really common and really, centering equity in particular as we're looking at our priorities. And in particular, there's a number of populations that I think are really important to really take the deeper step and look at some of those intersects in that process. So really appreciate that. I also want to underscore the importance of that partnership with media to tell the stories from the perspective of older adults with lived experience and how powerful that is. I think there is incredible work that CDA is leading and undertaking in partnership with different communities, throughout the whole state. And I think it never hurts to continue to, tell the stories, particularly through the perspectives of these individuals, as it then helps to share what's going on and why it's significant, why it's important, and increasing the awareness and allyship, in fact, of others too. So I think that's incredibly important. And my last comment is, or actually it's more of a question, and it's more of a process question, Marina. It's also about, I know that we had, once upon a time, pre-COVID, we would come together in these meetings, so I am wondering if there will be an opportunity in 2024 to perhaps come together, in person for one of these meetings this year. And maybe you already have that planned, but I just wanted to, I didn't hear it, so I wanted to ask that question. Thank you.
Well, first of all, thank you, Rigo, for mentioning allyship. Allyship is very important as we just continue to work together cross-sectorally, because we want to work smarter, not harder. And I think that there's a lot of good efforts on the equity fronts through philanthropy, through state government, through local, AAAs that we could really leverage. So thank you for mentioning the allyship. Also, I love the idea of getting together, and I have researched that, and since this is a volunteer committee, there are no resources available to do that. However, we also create opportunities, right? So one thing that I failed to mention is that we are having our Day of Action on October 8th in Sacramento. It will be held at the Sacramento Convention Center. And I think that would be a great opportunity. I'm hoping all of you can attend, that we can organize maybe a meeting, somewhere fun, somewhere, maybe at Cal Endowment when they have ping pong tables or something, and just get to know each other a little more, come together, and but also be intentional about our time together. So I know there was another suggestion, I think it was from Denny, for another conference or meeting that's happening, I think in the Bay Area, that he was thinking maybe if folks were attending that we can get together informally. So, so I welcome any suggestions for that. All right, let me just scan here to see if there's any other thoughts, comments.
Vincent has his hand up, Marina.
Okay, Vincent, you're on.
Hello again. You know, I was thinking, I agree with all the comments that are being said. And, but one of the things that I'm seeing a need for, from what I hear, is we focus on older adults, but when it comes to caretaking, sometimes it's every level of the family and it's different in different communities. So I'm wondering if, like, maybe generating, using the journalist angle, a series of stories where you try to talk about taking care of your elders in your community, and how it impacts. You know, it'd be great if older people could share their lessons learned and what they would, but like younger people who will one day be older people, hopefully, you know, what do they see they need? What is the world that they want to age into if they're taking care of their elders? You know, what would be helpful to them? And, you know, this could be, there's a lot, you know, we could look at families, we could look at individuals, we could look at non-traditional families. You know, for a lot of our older folks in San Francisco who are living with HIV, their support comes from friends.
Yeah.
But we're seeing that they all die. And then we have a Black women's program that's just started. And when they show up at our events, they bring their whole families. And so you have to multiply. So there's just different things and nuances that I think people need to know. And then, like, related to the stories, we could have things in your area. This is who you contact. Do you resonate with this story? This is who you would contact. Because I think a lot of people just don't know where to go. And but they seem to relate. They can see themselves in someone's stories, and they're more likely to pick something up and look into it.
Thank you, Vincent. All good points. So one of the things that with the few minutes remaining that I want to just circle back on is I've heard a lot in this discussion. And so one is the HIV and Aging Act. And, you know, where are we at with that? And how are we going to lead with that? An endorsement for aging farm workers. You know, an invitation to the HIV and Aging Conference in June. There's been some comments regarding, you know, spreading the word, messaging, working with media, and, you know, our allyship with others, and then more, you know, information regarding LGBTQ plus data, trans population in particular, allyship, and caregiving and caregivers and resources. So if we were to package that, what that looks like, what, you know, because one of the things when I have discussions like these in committees, you know, we walk away with all these great ideas and we have like thoughts about how we want to move forward. But I would really like to walk away. My takeaway today is if we had to, you know, select 2 or 3 big wins for the end of the year, what would that look like? And really leaning on you all to weigh in. I will also reach out to others who couldn't attend today. And perhaps we can issue a survey with some of these thoughts and ideas. And then, you know, in between meetings, I can report out what the survey findings are, listing some of the topical areas, and then getting endorsement from the other committee members. Does that sound like a reasonable next step? Like, you know, documenting what we heard today, you know, putting that in a survey, issuing that soon after this meeting, reporting out what we've discovered. And then also, I just wanted to reiterate that there will be other opportunities to, you know, provide recommendations at the day of action that maybe we can participate in, maybe not lead, but still be a part of, similar to what we're doing with the CDA priorities now. Does that sound like a reasonable next step? You can raise your hand function or just in the chat say yes, so that we can move in that direction. Okay. Thank you.
Marina, I want to point out that Julia has her hand up.
Okay. Thank you. Julia, go ahead.
So to answer yes to what you just asked us first, and then this was to piggyback off of the comment that Vincent threw out about, crafting those stories. I just wanted to share that one of the highest traction stories that I produced with a video and an article was a feature piece of a young woman who got pulled into family caregiving for her grandfather, he was a good friend of mine. And so I was able to guide her through some of the things that she needed to do. And we just shared her story. We shared his story. And it literally was one of the highest traction stories. And I think I titled it something to the effect of when family caregiving meets millennials, what does that mean for the workforce or something like that. So just FYI, it's that piece across the age range, to really pull in that next generation to say, this isn't just something for those people, it's all of us. So just wanted to share
Right.
that.
Thank you, Julia. And so I'm reminded as well that CDA is in the process of developing a caregiver roadmap, equity roadmap. And so I love the thoughts and ideas that you mentioned, Rigo, as well. That sharing the story from the perspective of the elder. And I think this could really help support even, our tribal work where we're we recently were on a call, Consuelo and I, with Chico Enterprises, and they represent about 12 regional counties that are mostly rural. And we were reminded again of, no transportation when we're looking at like in Butte and Bernie Falls and things like that, and just lack of internet resources that aren't readily available. And so being able to just message and reach and work, within those isolated areas and just give people hope and try to get, some knowledge to them is very important and key. So those stories really are compelling and can make a lot of change as far as policy goes. So I'm eager. And Julia, I'm just gonna like reach out here and say that I think with all your knowledge and background, like you could really support us in this. So I'm happy to reach out to you and we can have some offline discussion. I think that would be really helpful if you're amenable to that.
Yes, it'll be a race of who emails who first.
Great. All right. Well, we are at time. I want to thank you all for just helping me, as I lead this effort within the department. And I really look forward to, just being able to get some good quality things done with your support. So thank you so much. And I will follow up. We will follow up with a survey, and I'm going to lean into you, call you. I may have you present at one of these meetings, and I'm really going to leverage that partnership. So thank you. So with that, we're going to continue on with our next presentation. And I want to turn it over to Ross Lalian to provide an update on the MPA equity framework. But I think Sarah is saying a few words before, right, Sarah?
Right. Thank you so much, Marina. It's such a pleasure to be here today and to talk about, all of these critical issues that you all have elevated. And for those of you I haven't met, my name is Sarah Steenhausen, and I'm Deputy Director of the Division of Policy Research and Equity. And it's just wonderful, knowing that this has been 1 year since Marina's first meeting with the Equity and Aging Advisory Committee, Equity and Aging and Disability Advisory Committee. So just so appreciative, Marina, of all the work and just incredible commitment to this work and to all of your engagement. The reason that I just wanted to say a few more remarks before Ross's presentation on the equity framework is to just kind of highlight how this work came about and the critical role that it started with. Obviously, when the MPA was developed, it was very intentional to have equity baked throughout the MPA. And we were so fortunate to have the equity work group at that time formed leading to the development of the MPA. And I will call out Rigo Saborio, Denny Chan, and Michael from AARP were really critical partners in getting that work group established. And it really helped inform the state's thinking, I believe, and thinking about the importance of equity in all things that we do. So we were really proud to see equity so embedded throughout the MPA, but then the Impact Committee, which for those of you who aren't familiar with our Impact Advisory Committee, they are the it stands for Implementing the Master Plan for Aging Together in California. And they are essentially kind of the oversight committee of all aspects of the MPA. And they provide us some important recommendations and thoughts for consideration on guiding the MPA as a whole. One of the really critical feedback elements that the Impact Committee provided us was thinking about, it's wonderful to embed equity throughout the MPA, but how are you actually going to measure it? How are you going to operationalize it? And how are you going to be able to see that 5 years down the road, you've made a difference, right? It's easy to elevate issues. It's a next thing to think about how we actually measure our progress. So I am particularly appreciative of the work of our partners on both the Impact Committee and this committee in helping us think through a framework. And then I also really want to call out the important role that Ross Lallian and Evan as well on his team and Marina have done in helping kind of develop this framework that I think is a really exciting approach to how we operationalize equity in the MPA. So with that, I'm going to hand it over to our amazing Chief of Research, Ross Lallian, who will walk through this. So thank you.
Thank you, Sarah. Excuse me. So good morning, everyone. I'm Ross Lallian, and I'm the Chief of Research with CDA. And I'm going to describe our equity data framework today. I'll provide some information about what this is, the purpose of it, the benefits of it, along with high-level information and a couple of indices that we've created as part of this framework. So one of the tools that my team manages is our data dashboard for aging, or the DDA. And the DDA is kind of our central platform to house MPA-related data. I joined CDA about 1 year ago, the same day as Marina joined. And since I've joined CDA, I've been working with the team and thinking about how we can build upon the great work that's been done already in the MPA data space, in particular with the availability of equity-related data. And with the data dashboard kind of in place, we had an opportunity to really build upon it and showcase data that's important to us. And one of the first things that comes to mind is developing the ability to quantify and track equity and to be able to look at that over time. And so currently with our data dashboard, it's more of a self-service environment. And we're adding to that by conducting some analysis on the back end and providing our consumers with some data and outputs that are easy to understand. And the overarching goal here is that we would like our consumers to understand how the state's performing relative to equity around the goals and strategies of the Master Plan for Aging. So as we've been developing this MPA equity framework, we've been doing so with the consumer in mind. That's really important to us because we want all of our stakeholders to find value with our DDA in this framework, not only researchers or their data folks. And so that's why it's important for us to provide context for the consumer. Our goal is for the data products to be user-friendly and present the data in a manner that leads to policy and program takeaways. So we've been working hard at that, and I'm looking forward to sharing some of those details with you today. We like to have more consistency across the DDA as well, but not only across the DDA, across other work streams as well. So moving towards this framework will allow for us to be consistent in the types of data that we like to collect and how we quantify equity. And as part of this effort, we're also moving towards standardizing data, and we'll be able to make comparisons across MPA goals and strategies. And that will allow us to compare how the state's performing from an equity perspective on different MPA topics. Go to the next slide, please. So before I get into the main topics of this framework, I'd like to kind of set context of how this framework fits into a larger process. There's a couple things to consider here. This framework is only related to the Master Plan for Aging. So we want to implement a framework that's used to better understand equity related to the MPA goal strategies and work streams. But beyond this framework, there's many other efforts around the state to better understand and quantify equity. For example, we meet with the California Health and Human Services data work group where we discuss a variety of topics, but primarily it's about how we can use data to advance equity. So we're plugged into efforts throughout the state. Just want to make clear that this framework is MPA specific. Also, this framework will not solve everything on its own because it's part of a larger collaborative process. And that's what you see depicted on the slide here. I'm willing to work with you all and our valued stakeholders to ensure that we have a consistent understanding of these issues, that we're working together, understanding potential policies and solutions to help address what the issues that we're working on. So we view this framework as a critical building block for us to better understand these issues, have data to help communicate these issues, and have data to really help drive our decision making. We'll go to the next slide, please. So with that, I wanted to introduce a few concepts to you. So as we build upon the current state, we've been focusing on data products that are equity-driven and consumer-friendly, and our equity index is being developed with those goals in mind. And so the purpose of this equity index is to provide the consumer with a better understanding of equity related to the goals and strategies of the MPA. And this index will be available on our data dashboard, and then will accompany many of the visualizations on there. So this equity index provides a method for us to understand variation between groups on relevant equity topics. You see some of those equity topics in the slide there, things like age, race, ethnicity, language, sexual orientation, etc. And the scale of this index is 0 to 100 by design. So we want to implement a scale that makes sense to most people. There's many indices out there, and the scale could vary, right? It could be something like -1 to 1. That's a little bit harder to interpret. Is 0.2 good in that example? So I think this scale is more intuitive. That's kind of our hope with that. So higher numbers indicate more equity, lower numbers indicate less equity, or there's more variation between groups. We have a couple examples here on the slide. This is related to having a unusual source of care. And there's a couple of call-out boxes on the slide. There's an education call-out box and one for language. So for education, the equity index score is 90. That's pretty good, right? 90 out of 100 is relatively high. And the reason for that is because folks perform similar, regardless of their education level, they achieve a similar level of having that usual source of care. So if you look at the call-out box there, for folks that have a high school diploma, their usual source of care rate is about 93%. For folks with a PhD, it's about 95, so it's pretty similar. But the story is different for language spoken. The index score there is only 55, and the reason for that is we see more and more variation there. Only 80% of Spanish-speaking folks have that usual source of care, compared to nearly 96% of folks who speak English. So this is an example, and we're hoping to have the data displayed in this manner, and that will lead to insightful and easy to understand takeaways, and that's kind of the purpose of this equity index. Go to the next slide, please. We also want to be able to track equity over time, and this index provides us with that capability. So depending on the respective indicator, we have historical data, so we can conduct this type of time series analysis today. But going forward, this is going to be a priority for us. So we can track individual equity targets. For example, something like language is spoken, we could set a target of 85 or 90 and track that specific equity topic, or we could take a more holistic approach. For example, with usual source of care, our target could be 85 or 90 across all the different equity index topics. So setting targets is a really important component to this exercise. Having the ability to track equity over time will better enable us to identify trends and better understand if we're making progress, and if so, how much progress are we making. Next slide, please. So I mentioned standardizing data as part of this framework, and I want to highlight this concept because I think it's important. So our policy, data, and subject matter spans so many sectors. Aging is everything, right? And from a data perspective, that presents some challenges. Generally, it's difficult to make cross-sector comparisons, and a lot of the time it's probably not appropriate. But for us and the work that we do, being able to assess equity across the MK, that's important to us. So this equity data framework allows us that capability, because we're using that 0 to 100 scale for all the indicators on the data dashboard. So this example here with fictitious data, we're able to compare equity across several MP-related initiatives. This example is showing equity related to race, ethnicity. However, we can also conduct the same analysis with any of the equity topics and better understand where the greatest inequities are. So currently, we're finalizing the equity index with the work group that we've been working with. The work group consists of folks in academia, philanthropy, the private sector, with some of our state colleagues as well. And these folks have subject matter expertise in math, stats, and/or equity, which is all very relevant to this exercise. So as we wrap up with the work group, we're planning on having the equity index implemented sometime within the next few months. The next slide, please. Thank you. So there's another index I'd like to share with you all. This is what we're calling our greatest economic and social need index. And I think this is extremely relevant as a tool we can utilize to better understand need and allocate resources with greater accuracy. And so we created this index because we took a look at what indices were out there, and there's many of them out there related to economic factors, climate related. However, we didn't come across one that really met our needs, and that's understanding the economic and social needs of older adults throughout California. And because the nature of our work is broad in terms of the subject matter we cover, we knew that we'd have to look towards a tool that integrates many different types of data. So we needed to create a custom index that integrates several disparate data sources, and one that kind of informed our collective thinking about regional needs for the populations that we serve. So this can be a resource allocation tool. So we leverage these data to better understand the needs of the community. We can hopefully allocate resources with more accurately and also more effectively. So as we developed this tool, we kept the Older Americans Act in mind and tried to ensure alignment as much as we could in terms of how economic and social needs is defined. And also think it's a good example to share with colleagues. It's an example of how we can pull in several different data sources and create this usable resource. Integrating different data sources can really be powerful in terms of insights that we wouldn't necessarily get from standalone data sets. It's also a tool that the state can utilize, but the folks at the local level, so it can help inform program development and again, be a tool to inform resource allocation. Next slide, please. To set the basis for this index, again, we look towards how the Older Americans Act defines economic and social needs. So economic need, not surprisingly, is around income and poverty. We generally know where to go for those types of data. And it seemed a bit more straightforward compared to social need, because social need encompasses several factors, right? Disabilities can create a social need. English as a second language or not speaking English, that can create a social need. There's also different factors that can create social isolation. Geographic isolation, for example, there's racial and ethnic factors that may cause one to feel socially isolated. Even disaster recovery and climate change can lead to social need. So social need isn't as clear cut. And there's so many potential factors that we could consider. And the challenge from a data perspective there is that when you have something that's kind of open-ended in some respects, we can keep adding more and more data, and at a certain point, we can overfit our model, and that can lead to diminishing returns. So keeping that balance in mind of exploring data sources, but not overfitting this model, we identified variables in data that can help us quantify economic and social needs. And we went on a bit of a data exploration exercise. So we wanted to understand what data can help inform this process and help us better understand economic and social need. And this table lists the data sources that have informed this index. There's 18 in total. There's demographic factors, there's race ethnicity data. I'm looking at the proportion of older adults that represent people of color at the county level, non-English language is spoken, the proportion of older adults that live alone, population growth. In addition, we looked at several other factors, for example, health professional shortage areas, HIV status, housing cost burden, disability, et cetera. So for each of these characteristics, we calculate a rate for each county, and then rank counties in order of lowest need to highest need. So the higher the score, the greater the need with this index. We then divided the counties into 10 equal groups to create the overall index score. Go to the next slide, please. So this map displays the highest and lowest needs based on the index score by county. Something that kind of jumps out to me is that the highest needs are all rural counties. So after reviewing the data, and thinking through it out, that actually makes a lot of sense because a lot of economic factors in those communities that will impact the score. There's large Spanish-speaking populations. There's not many healthcare providers, et cetera. For the counties with least need, those contain different types of counties. So Marin and San Mateo, for example, there's less economic need within those communities. The over 60 medical eligible population is relatively smaller. There's also more healthcare providers, and they aren't as geographically isolated. Amador County has a lower score, but for different reasons. There's less racial and ethnic diversity there, relatively speaking, which brings the score down. They have less folks that speak non-English languages. And Mono County is similar in terms of there's less diversity there, but there's also less relative economic need. So I think the takeaway is that there's different reasons why a community can score low or high with this index. And this map visual is a good resource to understand need at a broad perspective, but then we can drill down and understand the underlying reasons why as well. The next slide, please. So this slide is a depiction of need by planning service area, which make up our AAAs. And I think the takeaway here is that some of the PSA show variation in terms of need. So PSA 4, for example, that's made up of several counties. That shows low need, but also relatively high need as well. So as we combine counties, there's going to be variation. So our state is very diverse in many ways. So there's going to be variance. So PSA 4, there's Sacramento's counties and there's Sierra County, very different counties. So maybe this tool is more effective when viewing from that county lens. But in terms of next steps with this, we're going to fine tune this tool a bit. For example, everything's weighted equally currently. We may want to assign greater weights to factors that we consider priorities. And if you have any questions about these indices, I'm happy to answer here in a couple minutes here. Just a couple more slides. Next one, please. The last concept I want to share with you is related to the development of MPA-related outcome measures. So I've been working closely with our Aging and Disability Research Partnership on this effort. We've made a lot of progress. There's a focus on equity in the development of these measures, and the development of outcome measures kind of brings our framework together. Essentially, these measures will serve as a mechanism to track MPA-related impacts. The measures currently include decreasing homelessness for older adults, psychological distress among older adults and people with disabilities, and also reducing burdens faced by family and friends caregivers, and increasing the supply of our direct care workforce. So we've been working with the research partnership and other state partners and academic partners to identify data that we can leverage to track these measures. We've acquired several high-value data sets. And also, again, equity is a key component of this exercise. So with each measure, we want to be able to display the gaps in equity and be able to track that over time. So this equity index, again, is very important here because we plan on developing a dashboard for each of these measures and including that on our data dashboard for aging. And we'll add an equity index component to it. The equity-related variables will include are going to depend on what data is available, but this slide kind of lists the types of variables that we like to include and track as part of this exercise. We'll go to the next slide, please. So the last slide I have here, this is an early draft of what an outcome dashboard will look like. On the data dashboard, this is going to be interactive, but on this slide, it's obviously static. And this example is related to our measure around homelessness. And these data are specific to older adults who are experiencing homelessness. Across the top ribbon, you'll see information related to the baseline year, the most recent year, and also a target. The target's fictitious for now, as we work with the partnership on setting an appropriate target. We also have a status on each dashboard, which indicates if things are getting better, worse, or kind of remaining static. On this example, unfortunately, things are getting worse. But I think most relevant to this group is the equity score on this dashboard. So looking at race, for example, essentially what this is saying is that there is a lot of variance based on race. So on the data dashboard, you'll be able to click on that bar and see some more detail. But if you did click on that bar, what you'd see is that Black older adults are disproportionately unhoused compared to other groups, which is bringing that equity score down. The gender score is relatively low because more males are unhoused compared to other gender groups, according to the data that we've received. We also have the interactive map there, which if you click on it, there's going to be more information. And then on the right-hand side, we have potential drivers of homelessness. So I want to share this example with you because these are the types of outputs that we can start producing and including on our data dashboard for aging. So that's the last slide I had, and that was a ton of information, but I think we have plenty of time for a Q&A, and I'm happy to answer any questions you may have. Go ahead, Sarah.
Oh yeah, I just wanted to thank you, Ross, for that excellent overview, and just again to kind of help provide a context for this. I think all of this really excellent way of framing data and measuring equity will ultimately help us in how we target resources, how we identify needs, how we do planning for the population. So all of the data that Ross just reviewed, I think we would love any input you all have on how we might use it to do just that, to measure population need, to target resources, and to plan. So thanks for all of your input on that.
Hi, I just want to turn to any of the committee members. I see that Jack's included a comment, just thanks, Ross, intriguing data to be digested and discussed. And so I guess the question I have, Ross, and you're always so gracious with this committing every time to come present, is just when you speak of the proposed equity index, is there going to be an opportunity for this committee just to weigh in on that or provide any input or feedback? Or, if there's anyone more interested, can they reach out to you?
Absolutely, yeah. Yeah, so I think Jax is part of the equity index work group. And once it's on the data dashboard for aging, I'm happy to come share the results with the committee. And if folks have feedback, we're happy to hopefully integrate that in there. But if someone's more interested and wants to have a one-on-one conversation, please email me. More than happy to meet with you.
Okay, great.
Yeah, that was a lot of information. I feel like there's so many things going on in the data space more related to equity, but I think it's the start of the kind of the
Yeah.
products we can produce, include on our data dashboard for aging, and really quantify equity and be able to understand if we're making progress or not, and be able to track that over time. So really important work.
Yeah, absolutely. Thank you so much. All right. Well, I don't see any other hands. So we're going to move right into the LGBTQIA.
So I think I'm up again, right?
And you're up again. So take it away.
Okay. So I'm really excited to discuss the survey today. And I think I provided the committee with an update on the survey months ago, but I'm excited now because it's actually live. It went live this last Monday, January 8th. And so, as you recall, this effort came about because the states never collected data on the older adult LGBTQIA community, and all the work that man undertakes grounded in equity and lifting up underserved communities. Without data, we don't fully understand the needs and experiences of the community. We also aren't allocating resources as accurately as we could be, right? And so that's why the survey is so important and why we're excited to get this out in the field. So CDA is proud to support this effort. We're working with a phenomenal team. We partnered with Citrus team at UC Berkeley, with Open House in San Francisco, a research team at UCSF that's really talented. And Open House has really led efforts to ensure that we work closely with the community. And they've been a great partner. As I said, the Citrus team has really helped keep this project on track. They've been great collaborators and kind of project managers on this effort. And then we're also the research team at UCSF. These are the folks that administer the PRIDE study, if you're familiar with that. So they're really talented and well-versed in survey design, data analysis, and also presenting the data in an easy to understand manner, which we thought was really important. So this round of the survey is to collect baseline data. And our hope is that CDA and or one of our partners can administer this survey periodically in the future. So we can really build upon this baseline data set and really understand how needs are potentially shifting. So the overarching goal with this survey and the data coming out of it is to inform policy and inform policymakers and healthcare providers and other advocates on how to improve healthcare access and quality for the LGBTQIA older adult community. Because based on previous research, we know that the LGBTQ community faces significant barriers in terms of accessing healthcare, receiving timely care, maintaining a usual source of care, and this experiencing unfair treatment. So we hope that this data can really help lead to improvements, the expansion of training across healthcare networks, improved access to LGBTQ affirming providers, both on the medical side and the social service side, and the development of programs based on community needs. And also the survey really advances the goals of the MPA. So the survey touches on several goal topics, but it really gets at equity, which is what the MPA is grounded in. And we need data about under-resourced communities to really start making progress. Go to the next slide, please. So this is a slide that shows a timeline of the study. We're obviously beyond the planning phase and the survey refinement phase. Again, this launched the survey on January 8th, so it's live right now. We'll conduct analysis of the survey data in spring once we actually have the survey data. Then we'll have outputs to share by early summer. Move to the next slide, please. Thank you. So I mentioned that Open House was instrumental in ensuring that we work closely with the community on this effort. And so Open House led efforts to develop a statewide coalition, and the study team partnered with that coalition, and we're leaning on the coalition to help promote and distribute the survey. And so essentially this coalition is comprised of 52 organizations throughout the state. These are LGBTQ centers, area agencies on aging, healthcare providers, community centers, et cetera. And we have representation all over the state, in LA and other parts of Southern California, the Bay, Sacramento, Central California, Northern California, et cetera. And a subset of this coalition served as a survey advisory group. And so the research team met with the survey advisory group several times as we developed the actual survey instrument. Really valuable feedback from the advisory group on things like what questions to include, what to possibly not include, the phrasing of questions, response options, et cetera. Jackson, Vincent were on the survey advisory group, so thank you both. And we understood it's critical to gain the trust of the community to really garner a high response rate. And I think in partnership with Open House, we've made progress in that regard. And partnering with the coalition and advisory group has led to a much better product. Next slide, please. So I want to share some high-level information about survey methodology. The survey domains include economic and social well-being, behavioral health, and physical health. We'll, of course, ask for voluntary demographic information from survey respondents as well. There's a couple other questions that might fall out of these domains, for example, access to technology. So it's a pretty wide-ranging survey. We estimate that it'll take about 20 to 25 minutes to complete. To qualify to take the survey, one must identify as a member of the LGBTQIA community, be at least 50 years of age, and be a California resident. Their survey will be available in Tagalog, Spanish, Chinese, and English. And there'll be an emphasis on oversampling the BIPOC community because we want to make sure that we have collect enough data to ensure that is statistically significant. I'm in the research team at UCSF. They employ the best practices when designing the survey. And of course, they have a lot of experience in this area. So really proud of this survey. Next slide, please. So in terms of outputs, we developed our first newsletter, which I think everyone received in the meeting notice. And we're going to produce 4 other newsletters as we kind of move along this process and make sure that you receive those. We'll also develop a more traditional long-form report and executive summary. We'll produce infographic-based flyers and kind of one-pagers based on that. And the survey instrument's going to be made public as well. We'll develop fact sheets and a list of community resources, and then also an open source database. And the thought there is that we want to safely and securely share aggregated data with other researchers and policymakers who can hopefully use those data to make impacts in their respective communities. Next slide, please. So the final slide is my humble ask to you. So it'd be really helpful if the community can help promote this survey. We'd really like to reach every community and region in the state and every type of community, whether it's rural, urban, or frontier. We will begin to really promote the survey next week on social media and other channels. And you should have received a promotional flyer along with the newsletter and the meeting notice. And so it's really easy to take the survey. It's as easy as scanning the code on the slide here. Also, CDA is hosting a webpage for the survey and the links on the slide. And we'll place that link in the chat. It's already on the chat, so that's good. And then Susan and I, it's the last thing I wanted to mention, we had the opportunity to meet with the LGBTQ caucus yesterday, and that was an opportunity for us to express how important this survey is and ask for their help to promote it as well. I mean, they were very engaged and will help partner with us to get it out. And I think it's going to be critical as kind of an all hands on deck effort to promote this survey and really ensure that we get the higher response rate, again, that's throughout the entire state and every region of the state and every type of community. So with that, that's the last slide I had. I'm happy to answer any questions about the survey. Go ahead, Rigo.
Yeah, Ross, thank you for this excellent presentation. Actually, both presentations fabulous. Thank you so much for all your work and leadership on this. That being said, there was earlier conversations about the impact of partnering effectively with ethnic media and other media in general. To what degree are you aware of that there might be some opportunities to partner with media to get the word out and promote this? Particularly, I'm always very interested in reaching those hard to reach communities who aren't necessarily already connected to, for example, the AAA network, for example, because I think oftentimes it's and kind of in thinking about the folks that were already working and reaching through AAAs, we have a better understanding and we're already connecting with them and providing services. It's those others that haven't yet connected, and this is being an opportunity to hear from them. So wondering if, to what degree media is being utilized as a partner in that. And I just want to make one other observation comment. I really appreciate the fact that you mentioned that you're oversampling BIPOC communities. And also really interested in the structure of the survey, because to really get under the hood and really see how these issues are impacting the different communities within LGBTQA
Right.
across California.
Thanks, Rigo. That's a really important point about like the AAAs are going to be critical. We don't only want to use them. So with media, so Open House has been working with some media outlets, and I think Marcy Edelman, she did an interview with one of the Bay Area LGBTQ papers there, which should be published soon. And we're working with CDA's Phenomenal Comms team as well, and I could reach out to them and really understand what media outlets we could leverage for the study, because again, it's kind of an all hands on deck effort to get different types of folks to promote this survey to make sure that it reaches different regions of the state. Then I'm happy to meet with you offline. We can go over the survey together, and I could kind of show you the different questions. Pretty lengthy, wide-ranging survey. But I'm happy to meet with you and go over the different domains and questions, etc. Thank you, Rigo. Go ahead, Jax.
Yeah, I just want to say thank you for your presentation. I thought it was excellent, and this is going to be really amazing to really go through once we get the data. I went over to the link to the page that had the survey, and I just wanted to find out whether or not, because it wasn't readily apparent to me when I was looking at that intro page, whether people are going to be, when they go to take the survey itself, will the survey, before they go through the lengthier parts of it, will it tell them whether or not they're qualified to take this survey or not? Because I'm not entirely certain on the front page of this that it really stands out very quickly as to who is intended to be surveyed here.
Great question. Yeah.
So I don't know whether or not, if I start answering the survey and I'm 35 years old and I don't necessarily identify as LGBTQIA, does a survey just bounce me out?
Yeah, there's a few qualifying questions to start things off. So it asks about your age, whether or not you identify as a member of the LGBTQIA community, whether or not you reside in California. And if you answer no to any of those questions, then it'll bounce you out. So we have those qualifying questions.
Okay, great. I just want to make sure of that. Thanks.
Yeah, good question. Go ahead, Vincent. I see your hand up.
Thank you. Great presentation. And I just wanted to say this has been a great process from the start. I think Open House did a really good job of mobilizing us. And I'll have to go. I don't think I saw the promotional kit, but is there a press release or anything that we could use if we wanted to promote it through our media outlets?
We're actually working on that right now, Vincent. So that should be out really, really soon, the next couple of weeks. So yeah, the press release will be out in a couple of weeks. We have the flyer, the newsletter, and I'll make sure that you have those. It should be in the meeting invite. I could email it to you separately. And of course, the CDA webpage, you could circulate that as well.
Okay, great. Wonderful. And thank you.
Thank you.
I also I have a question. So what about the folks that are not tech savvy, but they would still like to have their input and take the survey?
Great question, Michelle. So we have a email that folks could email, and then if somebody does need help, we're happy to walk them through it or find a solution for them. Currently, it's on Qualtrics, electronic based, but we do have that email resource and technical assistance available. So someone will have to email. That's the thing. That's the rub there, I guess. But if somebody does email that, we could walk them through it, and maybe even do a paper survey for them specifically. So we have that option there.
Could you put in that email in there, please?
Sure. Yeah, absolutely.
Ross, this is Jackie. The email that you want on the website, is it the UCSF one that's posted?
Yeah, it's the UCSF
is that the
one,
correct one?
Yes,
Just want
it
to make
is.
sure it's
Thanks,
the right
Jackie.
one. Thank you, Ross.
Betsy, I see your hand up. Go ahead.
Hi, thank you. I just put a message in the chat. I don't know if you saw it. I was curious if you were working with the Williams Institute at UCLA Law School, or if they knew of this at all.
I don't think that they know of this, but I could reach out to them.
Okay. Or if you want me to, you'd reach out to Brad Sears, or who would you reach out to?
If you don't mind, reaching out, Betsy, that would be great. If
Okay,
you could
well,
reach out to them, I appreciate it.
Okay, just if you want to send me whatever you want me to share with him, I'd be happy to do that.
Okay, sure.
And then I have a question with the IA of LGBTQIA. What is your definition of I and A? Because it's my understanding that A is ally, and most of us are. So if we're taking a survey from that perspective, I forget what I is. It changes from time to time, but so maybe A has changed too. So I was just curious what your definition was.
Good question. I'm not sure from the right person to answer it. From my perspective, intersex and then asexual is the A. I don't think this would be ally, because we want folks that are part of the actual community to take the survey.
Yeah, it used to be ally.
Right. So on our we have an FAQ page actually online. Hopefully folks can take a look at it. And it lists what LGBTQIA stands for.
Okay.
And so yeah, because we don't want, allies are great. Obviously, we're all allies. But we don't want, allies to necessarily unless they're part of the community.
Yeah, well, definitions are changing all the time. So, but thank you for that. But if you could send me what you want me to send,
sure.
Brad Sears, I'd be happy to do it.
Okay, thank you. Is your hand up again, Vincent, or is that from last time?
Yes, I had wanted to ask, when I've done these kinds of surveys before with different populations, and especially those that aren't tech savvy, we've had like gatherings, like we've served lunch and invited people to come, and we've gotten like 30, 40, sometimes 50 people to come and fill out something. Are there any issues with that, or would you just prefer it be one-on-one and people taking their own initiative to find it? Because it could lead to some oversampling of. you know,
There's no
but
issues on my end. I think if you can get, Vince, if you could help administer that and get 30 folks in a room, even though it would be maybe oversampling that specific area, but we still want to get the highest sample as possible.
okay, great. I can also reach out to some of our other partners that we work with and see if they can do similar efforts, because we do have a lot of folks that are kind of mistrusting of giving that kind of information, which I didn't realize how well. I kind of knew it, but it's become more apparent as I've talked about the survey with people. Like, oh, I don't know, I want to do that. So great. I'll circle back to you then.
Great. Thank you, Vincent. Appreciate it.
All right. Thank you so much, Ross. And congratulations on getting this out. That's groundbreaking work and under your leadership. And so you're a rock star. Thank you. Okay.
Thanks, everyone.
Yeah. All right, Consuelo, you're in the queue and looking forward to hearing your presentation. So there you go.
Thank you, Marina. Yes, thank you, Ross. Great job on your presentations. That's a tough act to follow there, but I will do my best. So today I'm going to talk to you about tribal engagement, and tribal engagement is one of our priorities here at CDA. And what we want to do is establish relationships and build trust between the CDA and the California tribes, tribal leaders, and tribal organizations. And by doing that, we want to kind of tap into our existing networks that we're currently collaborating or participating in. And so one example is the California's Governor Office of Tribal Affairs, and attending the monthly tribal meetings hosted by the California Department of Public Health. And then also continuing to meet with outside entities, organizations. For example, yesterday, Marina and I met with Chico State Enterprises, which was very valuable insight for us, just discussing the challenges and barriers that our tribal elders are experiencing. So the next topic here is we want to understand and identify those challenges and related to our tribal older adults and caregivers. So, participating in these meetings, identifying what those are. I think Marina mentioned earlier, transportation is huge in our tribal communities. Most communities are in rural areas in California, and just having access to transportation to attend appointments, health appointments, is very difficult for our tribal elders. And also, access to nutritious foods is also challenging, as most rural places don't have like farmers markets or big chain grocery stores. So just understanding those challenges, and ultimately we would love to create like a fact sheet for the CDA, issue policy briefs in the future. So this is our focus, and hopefully by the end of this year, we can begin development on the CDA's tribal consultation policy. So by meeting with existing, networks that we have, creating new relationships with our tribal leaders and tribes, we want to understand what those challenges are and let them know that we are here. We want to listen, we want to learn, and hear what their needs are. And hopefully by the end of this year, we can begin development on the tribal consultation policy. And I know we mentioned earlier about the CDA Day of Action. So we're hoping in October, so we're hoping that we can invite these tribal leaders and tribes to participate in the Day of Action, hopefully have a listening session or a meeting about, just kind of building that relationship and understanding the challenges. And so recommendations. So we are seeking to identify a tribal representative to join the EACAD. And I have reached out to a couple of potential committee members, but we would like to ask you if you have any recommendations, and we welcome your feedback. for a potential tribal representative to join the EACAD committee. And eventually, when we do have a person to join the committee, we would love to create like a tribal subcommittee. And we would welcome everyone that would is interested in participating, your thoughts, your recommendations, to join that subcommittee. And if I would kind of like to open it up to everyone, if you have any thoughts, recommendations about our priority for this year regarding tribal engagement, and any recommended tribal representatives to join the committee, we would love to hear from you. So I would love to take any questions that you may have, comments. So I'm checking here. I see, Jax, you have your hand raised, so please go ahead.
Thanks again. I just wanted to ask Consuelo, I don't know if you've already put it in the chat, also your contact information, so that when we do have recommendations of who we think we'd like to refer to you, that we can send it to you.
Yes, absolutely. I will put my email in the chat, and yes, we welcome your recommendations and feedback in writing. So yes, love to hear from you. Thank you, Jax. Okay. Let's see. Are there any other comments or any feedback? I see let's see here, a message from Elvira. LA County used to have a commission on Native Americans. Oh, you will follow up. Thank you, Elvira. And Vincent, can we get all the links in the chat emailed to us? So yes, Carol is shaking her head. Yes, we can do that. And I see Vincent has his hand raised. So please go ahead, Vincent.
I think I've talked more at this meeting today than I have at any of the other meetings that I've attended with you all. But
welcome.
I will reach out to some of my LGBTQ I contacts as well to see if they would be interested. We do have several who are from the different tribes, and maybe they can also recommend some folks as well, because I think it would be really important to get their voice involved in this as well.
Yes.
So I will reach out to you, and I will also reach out to my contacts and see if we can identify folks.
Okay, great. Thank you, Vincent. Okay. Let's see here. I don't see any other comments or hands raised. So I will go ahead and turn it over to Carol, who will do our public comment next.
Good morning. We are still in morning. We are a couple minutes ahead of schedule. I have 11:43 and our public comment is at 11:50. Marina, would you like we could go directly into public comment, or would you like to have any further committee discussion on this or anything important?
Thank you, Carol. Thank you. I just wanted to share a few more comments and then we can go into public comment. And this is related to tribal engagement. This is really a call to action and an ask. So we are very much interested in, like Consuelo mentioned, the tribal engagement piece. And so if you have groups that are already convening where you can connect us, or there's workshops that we can drive to or participate in, we really that's part of our listening session. We want to come in, let them know that we are at the department. We are also very much interested in working with our AAAs to understand what good efforts are already out there. So if there's, models where there's good connection between or good partnerships between AAAs and working with their tribal communities. I just wanted to highlight in our conversation with Chico yesterday, it was just a good reminder of all the cultural respect and cultural approaches that are needed, you know, in working with tribal communities, be it through the tribal council, the education that needs to happen because of their sovereignty and working government to government. Also just really understanding the difference in tribes living on and off reservation. And so there's a lot for us to learn and grow as a department. Consuelo has a lot of connections that will make this easier. But any support that you can lend, because you have those connections, because you're involved in, you know, community, specifically with Native American communities or elders, would be very helpful to us. So yeah, just email Consuelo, let us know, and we'll move from there. And the tribal consultation policy really comes from an executive order when former Governor Brown issued an executive order for state departments under the Health and Human Services Agency. I think there's about 12 departments, 5 offices that highly encouraged tribal engagement, tribal connection. And so we're trying to elevate that within the department. So thank you. Okay, Carol, we can move into public comment now.
Great. Thank you, Marina.
Sure.
This is our public comment period. For those of you attending by phone, you may press *9 on your dial pad and you will be put in the queue and we can unmute your line. Or of course, attending by Zoom, please hit your raised hand icon and we will unmute your line. And I do see a hand raised. This is Lisa Cooley. I do want to remind everyone 2 minutes is the max for public comment, so we can make sure we hear from everyone. So I'm going to unmute your line. Lisa, please go ahead.
Good morning, everyone. My name is Lisa Cooley. I'm a person with disability who is African American and over 50. And my question to you all is, what are you doing to meet the care needs of people who are too poor for traditional senior care services, but who don't make enough money to take advantage of private pay home health care services?
Thank you for your comment, Lisa. We will take that back. And we are opening comments for anyone else. Please raise your hand. We have Nancy Peterson. You have raised your hand. I'm going to unmute you. Please go ahead, Nancy.
Thank you, Carol. And thanks to CDA for organizing this meeting today and for all your efforts to increase equity across California. I work for a nonprofit organization in San Francisco, and listening to Ross covering some important points about data, I'm interested in the intersectionality of the vulnerable communities in terms of their needs. If we are taking a look at data for the different categories that we are studying, or if we're looking at how it impacts the communities when those community members present with different needs. So here in San Francisco, we have older adults that when they are monolingual and they are also part of the LGBT plus community and present with a disability, their level of vulnerability increases and their ability to access services becomes more limited. So yeah, that would be something that I would be interested in learning more about. And if there is anything that we can do as an organization to support your efforts, I know that you were asking for the survey and how to spread the word with that. So we'll make sure to do that here. So thanks again.
Thank you so much. And yes, please take the resources that we provided. We would love for your community to get involved. We appreciate your comment there, Nancy. Any other comments? Happy to take public comment at this time. You can raise your hand. And of course, if you'd like to provide written comments, please email them to us at engage, ENGAGE at aging.ca.gov. Happy to take your written comments at any time. So please feel free to email us. And any further comments? I don't see them. No hands raised, Marina. So I'm going to turn it back over to you.
Thank you, Carol. So first and foremost, I just want to thank the committee for being on today and for starting off our year in a good way. I want to thank Lisa and Nancy for participating in our meeting today and your comments. So appreciate you being on with us, joining us. I consider this sacred space where we're coming together and doing heart work. And, we bring our love, our compassion to this work and just elevating equity and raising efforts of social justice. And so I'm just really excited and thrilled that we can have this time to be together. And thank you for the conversation. Thank you for your feedback. And I look forward to our next steps together. So I want to highlight a few things I heard today because I want to let you know that I heard you. And also it helps me just in framing some of the meetings that are to come. So just one reminder is the day of action on October 8th. Soon we'll be sending out a flyer for that. I also want to remind you of upcoming meetings on April 11th and July 11th. I also want to just remind you that if there are any other recommendations that you have for new committee members, to please let me know. I will also be working with Carol to possibly do a small open recruitment. So it's been a hybrid between your recommendations and now reaching out further to garner a few other committee members. So thank you for that. During our priority area, what I heard is, a few things, a few items, SB 258, the HIV and Aging Act. I heard aging farm workers as a priority. We will be receiving information from Vincent on the Aging Conference in June 5th, hoping we can attend that. And then Julia, I'll be reaching out to you as much discussion happened regarding messaging, storytelling, engaging with journalists and ethnic media. The the other kind of component I heard is language access and language accessibility. Also just wanted to thank Ross again for your presentations today, and just inviting the committee to weigh in when appropriate on, you know, the initiatives, specifically the LGBTQ and the MPA framework, equity framework. So thank you. And what I also heard is that you will be, I think, Ross, you shared your email so that folks can reach out to you. I believe Jackie shared the website where people can get more information, where the committee can get more information regarding the LGBTQ plus study packet. So thank you. Also, as I mentioned, I will be developing a survey regarding the priority areas and sending that out so we can all hear your input and your vote on that. And so that members who weren't present today can also have an opportunity to weigh in. I also am mindful that with the priorities, you know, we should be listing out and being cognizant of listing outcomes that go with each of those priorities. Ross will be sharing the LGBTQ press release that you can then share to your counterparts on that. Also, Ross will be contacting Betsy to send the LGBTQ plus packet that will be forwarded to Brad Sears at UCLA, the Williams Institute. So, so I think that's it. Unless I missed something, I'm sure my team will let me know. Thank you again for your time. And I look forward to seeing you all soon, or being with you on Zoom soon. So have a wonderful day. Bye.